Hi there, and welcome to this video learning series on mental health topics for non-therapist professionals. My name is Lara Okoloko, and I'm a provider educator with the University of Washington's Addictions, Drug, and Alcohol Institute, where I support professionals like you working in behavioral health and substance use treatment. I'm also a clinical social worker with over 20 years of experience in both direct practice and teaching, and I've worked with interdisciplinary teams helping people navigate substance use and mental health challenges and helping their families do so as well. In this short video, we're going to talk about a really important part of this work, making effective referrals to services. Let's get started. Whether you're a counselor, peer coach, social worker, or nurse, you've surely had the opportunity to tell somebody about a resource they hadn't known about already or help them figure out a next step towards a goal. This is one of our most important parts of our work, is to act as a resource navigator. How we handle those moments can really make a big difference in whether our referral changes someone's life or ends up at the bottom of a garbage bin. So let's look at how to use motivational interviewing skills, how to make a warm handoff, and some other best practices that help turn referral lists into real connections for our clients. The first thing we can do is to know our resources well. The best resources are ones that are relevant and accessible to that specific client. And the best way to know that is to know what's available in your community. Next, we want to match those resources to the client goals. Resources will be relevant when they're matched to the client's goals and stage of change. For example, a client who wants to reduce methamphetamine use is probably not a good fit for an intensive outpatient program that requires abstinence, even if it's a great program. Next, we want to prepare the client for the resource. Help set positive and realistic expectations for how this resource will help and what will happen when they make contact. Address obstacles such as transportation, insurance coverage, or long wait lists to help prepare the way for your client. We want to help ensure that if your client does make contact, it won't be a dead end for them. The more connected we are, the more we can connect our clients. What ideas do you have to expand your referral network and build personal relationships with other providers? I like to ask for tours of a facility that I'm referring to, and I frequently invite community colleagues out to coffee or to a quick Zoom meeting so I can learn more about their services and get all my questions answered. And then you can also tell them about what you provide so that they know that they can refer to your program. You might want to use this QR code to watch Leilani Dawn's video about how to build your resource list as part of the Care Navigator training series. Making a referral shouldn't be for our own benefit, just checking a box or sending someone on their way to get them out of our hair. Really partnering with our clients means that we're working to understand their goals and their motivations. That way we can collaborate to refer them to services that they're willing to engage in. A motivational interviewing spirit really goes a long way. When we evoke our clients' motivation, we hear about what they want to change or get help with, rather than trying to convince them about why we think they should change or what help we think they should get. Respecting autonomy means that we really understand that no one has to do anything. We can't make anyone do anything, and that people really do get to make their own decisions, even if you think it's the wrong one. Of course, it might be our role to help people understand the consequences of their choices, but we can do so in a way that helps them to become an informed decider and respect that only they get to decide. Think about those moments that you've been in where someone's ready, or maybe just almost ready, to take the next step towards a goal they're considering. Maybe it's a connection to housing, a substance use disorder treatment program, or mental health support. These moments are full of possibility, but too often referrals just don't stick. People leave with a phone number or a website, but they don't end up making that connection. Motivational interviewing has a lot of helpful skills to teach us how to improve our effectiveness in moments like that. I'd like to tell you about one of them. The skill is ask, offer, ask. This is a way to share information or suggestions or referral contacts while still centering the client's autonomy, their knowledge, and their experience. Let me show you how that might sound. First, we want to ask. In this case, the provider starts by saying, "What do you know already about the help that we can provide with transportation?" Maybe the client responds, "I'm not sure. I've seen the bus with your logo on it." So now we've asked first what the client already knows, and we've listened to the client's response. Now we can build off of what they already know about or what they might be interested in knowing. So the provider might say, "That's right. We do have a bus that can bring you to the center for meals. I can get you signed up for that today if you want to join us for lunch next week. You could try it out on Monday. It's totally free, and my teammate Ben will be here to greet you and help you find a lunchroom. What do you think?" So the final question is important. We're now asking the client, what did they make of what we just shared with them? And then we listen to their answer and go from there. Let's try another example. Maybe the provider says, "It sounds like you're thinking about quitting smoking. What do you know about the services that are available to help you do that?" Maybe the client responds, "I know you can buy patches and gum, but I can't afford that." So again, we listen to the client's answer and we build off of what they might be interested in, what they already know. So the provider might say, "I know those products are expensive. Can I tell you about the Washington State Quit Line? It's a service that provides phone support and a supply of free nicotine replacement products, even if you don't have insurance. What do you think?" This skill starts with where the client has some motivation and interest, and then builds off of that by asking if you can share to add to what they might already know or what they might already be motivated for. So now we know what might be helpful to our client and we're ready to make the referral. Which do you think would be the best strategy for making the referral? Should we have the client look up resources themselves to show that they're motivated? Maybe we should give the client a list of resources so that they have everything available that's open to them in the community. Or should we do a warm handoff to connect the client to the new resource? Warm handoffs really are the best strategy whenever we can do them. You could pause here to grab the citations for these articles if you want to read a little more about it. A warm handoff is a friendly and personal handoff between you, the client, and the new provider. Ideally, whenever possible, we would want to call the new provider together with the client. Introduce your client, highlighting their strengths and goals. Be positive and encouraging about the connection. Be clear about the next steps to take with the new provider. If you can do this in person, even better. If you're referring a client to another provider in your building, walk them down there to introduce them if you can, or at least show them where the front desk is. Here's a sample script of what that introduction might sound like. "Hi, Lisa. This is Lara. I'm here with Chris. Chris has been working hard on stabilizing their recovery and is open to connecting with a recovery peer. Hey, Chris, do you want to introduce yourself a little more and maybe share what you're hoping to learn from this call with Lisa? Then Lisa can help set up a meetup with you." Now, we don't always have the opportunity to walk someone down the hall and introduce them to our colleague or to catch a provider on the phone to do the warm handoff. But even so, we can still ensure a few things. We can make sure the match is a good fit. We can make sure the provider is expecting contact from the client. Even if you haven't directly spoken to the provider and provided any referral information, we want to at least make sure that it's not going to be a dead end. We don't want to refer someone to a provider that's full or who doesn't take their insurance, for example. We want the client to know what to expect. If there's going to be a wait list, let them know that ahead of time. If there's going to be tasks to do, like a phone screening before they can meet someone in person, make sure they know that. And make sure you've attempted to remove any obstacles or at least address them with your client. All right, let's review what we've learned. First, don't be directive when you can be collaborative. Think back to the ask, provide, ask. This can help us avoid sounding patronizing or directive when we could sound like we're working with our client. Don't be pushy. Motivational interviewing tells us that when people are on the fence about change and we get pushy, they push back. Instead, affirm autonomy. Don't make people cold call if you can help them do a warm handoff. Taking the next step in a change process can really be intimidating or overwhelming to people. As much as possible, we want to remove obstacles, remove some of the unknowns involved. We want to make taking the next step as easy as possible. To do that, we want to find out about the client's goals and motivations. That is way more important than our goals or motivations. We want to really know our resources well so that we avoid sending people down dead ends. We want to prepare our client and prepare the way for them, and whenever possible, do a warm handoff. Thanks for watching this video on making effective referrals. I hope you come back to watch more videos in this series on mental health topics for non-therapist professionals, or other videos in our series for nurse care managers and peer navigators.